Erectile dysfunction is kind of a overall concept, which, as everyone knows, can lead to sexual dysfunction or inability to have adequate sexual function. Several reasons cause this. One is arterial insufficiency. This can be seen a lot with different heart conditions, as well as diabetes. There's also venous insufficiency as well, not able to maintain blood in the penis during intercourse. But overall, the concept itself just means that you're not able to achieve erections that are sufficient for sexual intercourse. Erectile dysfunction is very common. It can occur in up to 30 million men in the United States. And I think that's probably a low number, considering that number actually goes up with age, especially over age 65. It's especially common. So I think it's underreported, but the number that we do have is around 30 million. There are a lot of things that can cause erectile dysfunction. It can range from cardiac issues, arterial insufficiency, diabetes, as I mentioned before, is also a risk factor. Different medications can certainly be a risk factor, antidepressants, for instance. In addition, there can be other mental health related causes such as anxiety or stress. Different injuries can also cause issues with erectile dysfunction that cause issues with the vasculature or sensation. Spinal cord injuries can also cause erectile dysfunction. So really there's a multitude of things that can cause erectile dysfunction. So the diagnosis of erectile dysfunction is fairly straightforward. If someone comes to me and says, my erections are not what I want them to be, they're not sufficient for intercourse, I'm not satisfied, then by definition you have erectile dysfunction because it's not working what you would expect it to be in your personal situation. Now there are further tests. We can do penile Dopplers to really discern what the etiology is of your erectile dysfunction, if it's related to arterial or venous and those kind of issues, and I can quantify how severe it is. However, if you come in and say, I'm not happy with my erections, then you have erectile dysfunction. In terms of prevention of erectile dysfunction, what we have found is that overall health is a very important factor. Anything that is preventative from a cardiac standpoint is going to be helpful from an erectile dysfunction standpoint. Anything that helps prevent diabetes is going to help with erections. Staying in shape, physical fitness, those are all things that can prevent erectile dysfunction. That being said, there are some people that are going to develop erectile dysfunction regardless of these issues, but overall health and well-being are certainly things you can do to kind of mitigate the risk. When you're seeing a specialist that deals with erectile dysfunction, I think there are a few benefits. One, this person can be a little more sensitive to your issues and honestly take the time to really get to the bottom of what is going on. He's going to be up to date on the latest treatments, both surgical and non-surgical. The staff is going to be more accustomed to dealing with these issues. It is a sensitive subject, and having people that are used to dealing with it, I think, is very important. I think for the overall treatment as well as the patient experience. So fortunately, there are a lot of treatments for erectile dysfunction. The ones that most people have heard about are medications, Viagra, Cialis, etc. These are PDE5 inhibitors, and these can work in a lot of men. Typically, I do see more men that have failed these first-line treatments as they have been started by their primary care doctor, for instance. So we have different modalities. One of those is penile injections. Those tend to be very efficacious. Sometimes we do have to have concerns with how efficacious they are and go up slowly on the dosage of these. And the other treatment is surgical, which I'll elaborate on further. There are also some other treatments out there that don't have a tremendous amount of data at this point. There's platelet-rich plasma injections. There's also sound wave therapy for erectile dysfunctions. Some of these are pending clinical trials to really demonstrate the efficacy. But those are out there as potential modalities that might benefit people in the future. Determining the appropriate treatment for patients is a combination of first assessing what is the cause of the erections? Secondly, what are the patient's other medical issues that might preclude certain medications or treatments? Preference of the patient is a very big determining factor. And additionally, if there's other issues such as hormonal issues, we might try to treat that first with testosterone before trying any other medications and things of this nature. So it's very patient specific and individual. In regards to satisfaction rates for the different treatments, treatments that do work, they tend to work very well, and the satisfaction rate is upwards of 90%. Now, sometimes we try a treatment, it doesn't work, we move on to the next one. So you can see some of that. But fortunately, as I mentioned, we do have several treatments for this, so we don't have to be stuck on one. We have many other avenues we can explore. So some of the long-term consequences of not having erections are that unfortunately you can actually lose penile length over time if you're not getting good erections. We've seen this in patients after undergoing certain surgeries that affect erections that wait to get treatment for their erectile dysfunction, subsequently losing penile length in the process because those penile tissues are not being stretched out adequately. So it is important after any surgery or loss of erections that you get immediate treatment so that those penile tissues remain healthy. We get the penile stretched back out with normal erections again so that the tissue maintains its normal architecture.